Hello everyone. As INICET exam is over, so we will discuss the recall questions, and this is the first video of that recall questions. So the first question is, which of the following is not a live vaccine? So it's a very commonly asked questions, and it's a very easy question. So the options were rotavirus, measles, hepatitis B, and varicella. So as we all know, rotavirus, measles, and varicella vaccines are live attenuated vaccines, and hepatitis B is a component, recombinant component vaccine that contains HBsAg component. और अगर आपको ये तीनों ऑप्शन नहीं भी पता थे, स्टिल हेपेटाइटिस बी वैक्सीन सब मेडिकोस लगवाते हैं. So you must know about the hepatitis B vaccine that it is a recombinant component vaccine. Now, which of the following is the best level of evidence? So the options were case control study, cohort study, RCT, and meta-analysis. जो क्वेश्चन की लैंग्वेज वर नॉट वेरी सिमिलर बिकॉज जितना मुझे अभी तक पता चल पाया उसके अकॉर्डिंग आई हैव ट्राइड टू कंसोलिडेट इट. सो बट द क्रक्स विच आई अंडरस्टूड वाज कि दिस माइट बी द the way they must have asked it. The options were case control, cohort, RCT, and meta-analysis. So if you see the ladder of evidence, सबसे नीचे मतलब in these out of these four सबसे नीचे केस कंट्रोल स्टडी, देन कोहोर्ट स्टडी, उससे ऊपर आएगी आरसीटी बिकॉज उसमें हम ट्रायल कर रहे हैं, एंड लास्ट वन इज द मेटा एनालिसिस बिकॉज हम इसमें बहुत सारे ट्रायल्स को स्टडी करके वी आर मेकिंग आर एनालिसिस. सो द बेस्ट आउट ऑफ देम इज मेटा एनालिसिस. Now, which of the following is predominantly a waterborne disease? So, as we all know, hepatitis B is mainly through blood and sexual route. Hepatitis C is again mainly through blood and sexual route. D is also the same route as B. And hepatitis A is predominantly a food or waterborne disease. Which of the following is not a component of NADA's criteria? So first of all, NADA's criteria होता क्या है? NADA's criteria is a criteria that is used for congenital heart disease, and इसमें major criteria are there and minor criteria are there. तो major criteria में आता है diastolic murmur. Then another thing in major criteria is cyanosis. Then another thing is major criteria is CHF, and fourth thing is systolic murmur of grade more than 3. So, and five minor criteria are there, but troponin level is not a criteria, NIDA's criteria. अगर आपको ये भी पता है ना कि NIDA's criteria is for congenital heart disease, then also you can rule out the options because troponin level is used mainly for these ACS settings or for myocarditis, not for congenital heart diseases. This is the next question. Which of the following is not included in the primary survey of trauma? X-ray chest, yes. X-ray pelvis, yes. CCT is not included. Fourth option, I was not sure कि क्या था. And but CCT is not included because CCT में क्या होगा contrast देंगे, it takes a lot of time, and we also don't know about the kidney status of the patient. So generally avoid contrast CT at that point of time. X-ray is yes. So the answer is CCT. Which of the following is true about esophageal cancer? Options, I got to know only two options. Dysphagia is more common in solids than liquids, and dysphagia is more common in liquids and solids. But this is also a trick to solve questions if you know not know the answer. क्योंकि अगर दो दो कंट्रोवर्सी मतलब कंट्रास्टिंग ऑप्शंस आ गए तो आइदर ऑफ देम हैज़ टू बी ट्रू ओनली. सो थर्ड और फोर्थ ऑप्शंस क्या आते हैं उससे आपको फर्क नहीं पड़ता. तो इन दोनों में से कोई आंसर होगा. एंड एज वी ऑल नो इसोफेजियल कैंसर में द डिस्फेजिया इज मोर कॉमन टू सॉलिड्स. तो द आंसर इज ए. अगर यहीं पे एकेलेसिया कार्डिया होता देन ऑप्शन बी वुड बी द आंसर. Now, another question is which of the following is the test for antibiotic sensitivity? Again, a direct question. So, E test is used for antibiotic sensitivity, as we all know. ELECT test is used for the toxins of Corynebacterium diphtheria. CAMP test is used in Streptococcus for like subgrouping के लिए. And latest agglutination is also a test which is used in multiple bacterial infections. Now, which of the following vitamin deficiency will be there in a patient with history of gastrectomy? As we all know, कि vitamin B12 although get absorbed in the ileum, but intrinsic factor get released from the stomach only. So the answer would be vitamin B12. Now, which of the following is not a component of severe acute malnutrition? Very commonly asked questions. मतलब when I was in my final year, तब भी ये क्वेश्चन बहुत बार पूछा जाता था. Components of severe acute malnutrition. PG, NEET PG maybe in INICET, in FMG, in the CMS exam. So it's a commonly asked question. And options were weight for height, height for age, mid-arm, mid-upper arm circumference, and bipedal edema. So as we all know, weight for height is an acute marker, but height for age is a chronic marker. So height for age is not a component of severe acute malnutrition. Now, another question is कि इसमें what I've heard of is कि there was an image showing superior or better vision, and it was asked which of the following is not a component. So, as you all know, third, fourth, and sixth nerve goes to the eye and supplies the extraocular muscles, while second nerve, that is the optic nerve, goes through the optic canal only. So, the answer is nerve 2, that is the third option. I'll try to get more questions and will share with you. Till then, all the best. अगर आपको कुछ भी लगता है कि इनमें से कोई questions थे जो did were not properly consolidated, just try to tell me in the comment section. Also, if you know any more questions or if you recall more questions, you can just write down in the comment section. All the best.